Welcome to This Explainer. Today, we're taking a deep dive into that incredibly frustrating inner knee pain that's been keeping you up at night. We're going to break down the true causes and, more importantly, exactly how to fix it. So let's just jump right in.
Have you been there? You know the feeling. You felt something shift on the inside of your knee. Maybe it was during a quick game of tennis. Maybe you were just walking down the stairs. Or hey, maybe you genuinely cannot even remember when it started. If you're currently Googling your symptoms at midnight, stressed out about what's going on in your leg, let me reassure you right now, you are absolutely not alone, and we are going to figure this whole thing out together.
Here is our quick roadmap for today. We'll cover 1. Understanding your inner knee. 2. Common causes of the pain. 3. Decoding swelling and pain. 4. Diagnosing the root issue. 5. Treatments and safe exercises. And 6. When to see a doctor. Okay, Section 1. Understanding your inner knee and the mechanics of the medial side. Now, the medial side is exactly what it sounds like. It's just the inner side of your knee facing your other leg. You've basically got 3 bones meeting up right here: the thigh bone, the shin bone, and the kneecap. You've got ligaments dropping it all together and cartilage acting as this crucial shock absorber, so your bones don't just, scrape against each other. But think about the sheer amount of pressure this medial side takes every single day. Walking, standing, every single set of stairs. And look, if you're over 40, that cartilage is naturally starting to thin out anyway. So if pain just started popping up, it's really not some random coincidence. A lot of times it's just a matter of daily wear and tear. Moving on to Section 2. Common causes of the pain. Let's identify the suspects. If we break down your symptoms, you'll start to see that they're basically a built-in tracking system for your body. For instance, if you've got an MCL tear, which is that major ligament holding the thigh bone to the shin bone, the pain is going to be sudden and sharp, usually from a hard twist or maybe a contact sport. But if you're dealing with osteoarthritis, where that cartilage is slowly wearing away, the feeling is much slower and duller. It tracks with age or movement and usually gets worse as the day goes on. And tendon issues, they kind of land right in the middle. They feel tight and sore, specifically after you've been highly active. There are a few other frequent culprits you definitely need to be aware of. A meniscus tear often causes this really distinct locking feeling, where your knee literally will not fully straighten. It's super frustrating. Then there's Pes Anserine Bursitis. This one is actually fascinating because the pain sits strangely like a few inches below the actual joint line. Runners and cyclists get this a lot from heavy training without taking enough rest days, and people miss it all the time just because of where the pain actually lands. And finally, patellofemoral pain syndrome, which is just when the kneecap sits slightly out of place and sends that pain radiating inward. All right, Section 3, decoding swelling and pain. Let's make sense of these confusing symptoms. So the crucial point here is understanding the bizarre relationship between pain and swelling. If you have pain with absolutely no swelling, that usually means the problem is on the milder end of the spectrum. We're talking mild tendon overuse, maybe a strained muscle pulling on the joint, or early cartilage wear before fluid has even had a chance to build up. But what about swelling with no pain? Sounds completely backward, right? But what's happening is that fluid is building up in the joint before your pain signals have even caught up to the problem. This counterintuitive scenario happens constantly, and it raises a really big question. What could actually be happening inside your joint when it puffs up like a balloon but doesn't hurt even a little bit? Well, even if it doesn't hurt yet, your joint is definitely reacting to something. The usual suspects for this painless swelling are things like a small fluid buildup from simple overuse, early-stage bursitis, fluid retention just from standing on your feet way too long at work, or a Baker's cyst, which actually pushes fluid forward from behind the knee. The major takeaway here, just because there's no pain doesn't mean nothing's wrong. It is absolutely worth monitoring closely. Let's move to Section 4, diagnosing the root issue and how doctors actually find the answer. A doctor's diagnostic toolkit is pretty extensive. It always starts with a hands-on exam, checking your range of motion and your ligament stability. From there, they might pull out X-rays to check for bone damage, MRIs for soft tissue like that meniscus we talked about, ultrasounds for fluid, or even blood tests just to rule out an infection. But honestly, believe it or not, your personal activity history is the real MVP here. Explaining exactly when the pain started, what sports you play, and any old injuries you've had, that speeds up a diagnosis way more than a fancy scan half the time. It gives the doctor the exact context they need to put the puzzle together. Okay, Section 5, treatments and safe exercises. This is your blueprint for relief. So here is your immediate first aid checklist. If you are hurting, you've got to start with conservative treatments. Rest and change up your activities. If running hurts, try swimming or cycling to lower the physical load on that joint. For the first 2 or 3 days, use ice to drop the swelling, and then switch over to heat to improve blood flow and loosen up those tight muscles. Use compression wraps, elevate that leg above your heart level so the fluid actually drains faster, and if you need to, grab some over-the-counter ibuprofen to handle the immediate pain and swelling. Now, when you're finally ready to start strengthening the area, you have to be super careful. To build up that quad strength without bending the knee and causing extra friction, you'll want to follow these exact steps for a straight leg raise. You lie back on the floor, bend one leg, keep the other one totally straight, and lift the straight leg right up to the height of your opposite knee. Hold it there briefly, then lower it nice and slow. But remember, and this is a non-negotiable rule, you have to stop immediately if you feel any sharp pain. Wall sits are another incredibly good option for this. You just put your back firmly against a wall, slide down to roughly a 90-degree angle, and hold that position for about 30 seconds. They are amazing because they give you solid, real-world strength gains in your legs with absolutely zero impact on the knee joint itself. Zero. But look, what if rest and home exercises just aren't cutting it? If those conservative options fail, medical science has your back. Interventions range from customized physical therapy, where they literally fix whatever movement pattern is loading your inner knee incorrectly, to corticosteroid injections that bring down that severe inflammation super fast. For arthritis, doctors might even use hyaluronic acid shots to improve the joint's lubrication. And in severe cases, like a full ligament tear, surgery is there to step in and rebuild what's been damaged. Finally, Section 6, when to see a doctor, and the red flags you simply shouldn't ignore. As a general rule, you should give home care a solid week or 2. But if you're experiencing any of these red flag symptoms, like literally no improvement after 2 weeks, swelling that just won't stop growing, a knee that physically locks up or buckles and gives out on you, an absolute inability to bear weight, a visible deformity, a fever, or pain that is so bad it actually wakes you up in the middle of the night, you need a real medical check, not a guess. Getting checked early is so important. Dr. Chuck Nguyen and the team at Conscious Regenerative Medicine see these exact problems constantly. Their whole approach is focused on finding the actual root cause and building a personalized plan for you, rather than just handing you a generic printout of stretches and sending you on your way. Trust me, getting checked out early makes the healing process so much faster and easier. Before we wrap this up, I want to tackle a question that comes up all the time. People are constantly worried that they're doing more damage just by moving around their house or going for a light stroll. So, the big question, is walking bad for inner knee pain? Well, the good news is no. It's actually not bad at all. If the pain is mild, walking is actually highly helpful for keeping the joint from stiffening up even further. You really want that gentle movement. The only rule you need to follow: just stop if the pain suddenly sharpens or if you notice the swelling increasing during or after your walk. You just have to listen to your body's built-in alarm system. And that wraps up our explainer on inner knee pain. Remember, this pain almost always has a very specific cause, whether it's a worn-down cartilage, a super sore tendon, or a hurt ligament. You now have the tools, the deep knowledge of your own anatomy, and the roadmap you need for relief. So what steps are you going to take today to finally start your healing journey?